Hello, my name is Tanisha and I'll be showing you the sanitization of semi-critical medical equipment. I'll be using a fork, spoon, and a knife for this demonstration. The PPE we will need for this is goggles to avoid any debris contact, a mask to cover your nose and your mouth from any debris, heavy-duty apron to cover from any splashes, and heavy-duty gloves to cover most of your forearm, and highly tear-resistant to to prevent any pokes from sharp objects. Lastly, any loose hair has been tied up and away from the face to ensure it doesn't contaminate and doesn't get contaminated. As per IPAC, this procedure should take place in a room that has adequate space for cleaning, process, and storage. Slip-proof floor is necessary as well as proper temperature and ventilation. Before we start, we have opened our window to create a fresh airflow for proper ventilation from the chemicals. We will start by immersing our contaminated objects in a solution of 1 ounce of an enzymatic cleaner to 1 gallon of water for 1 to 3 minutes as per instruction. These are now fully immersed and will allow them to sit for 1 to 3 minutes as per the instructions. Once we have allowed the objects to soak, we will clean the objects using a sponge, but keeping the objects in the bin to reduce any splashes. Once all objects have been scrubbed, we will rinse these objects under running water to remove any detergent on the objects. Once rinsed of detergent, we will move the objects to a clean, lint-free, soft absorbent towel. I've changed my gloves to a clean pair of heavy-duty gloves to control contamination. Using another clean, lint-free soft towel, we will dry the objects before placing them into a disinfectant solution. I will be using a Metricide solution. If you open a new bottle, do not forget to write on the bottle and in the logbook the date that the bottle was opened, and check the opening date to ensure we do not pass the expiry date, which would be 75 days. We use test strip on our disinfectant to ensure our solution has the active ingredients it needs to properly work. Once we confirm that solution is good to use, by the magenta color, we will submerge our objects in the solution fully. We want to make sure that nothing is above water level. This will stay submerged submerged in a closed biohazard labeled bin for 12 minutes at a minimum of 20 degrees Celsius. We label the bin biohazard to prevent any exposure to someone moving. Once this time has passed, we will take the object out and rinse with sterile water. Now this step is repeated 3 times. Once this is done, we will grab another clean towel and dry the object. Once this has been done, we can store them in a clean utilities drawer where they will remain until needed. My clean utility drawer is right below. We must now remove our PPE. We will remove our gloves first, ensuring that nothing touches our skin, and we will drop them in the trash. Next, we will remove our apron. This is to be disposed of with the linens to be cleaned, ensuring we don't touch the outside of our gown. I will then use hand sanitizer before removing any face PPE. We will remove our goggles and dispose of them. And we will remove our mask from the back so we don't touch and dispose of that. Washing our hands prevents any contamination from transferring. And you'll want to do this in lukewarm water to prevent any damage to your skin. You'll want to grab a clean paper towel or towel to dry your hands and your arms. Then to remove the tabs, turn off the tabs. And this will also go in the linens. Once all of our bins have been cleaned that we had used, we will clean our work area. With a clean piece of paper towel. And this will be put in the trash along with our new gloves that we had worn for this process.